Welcome to today's health segment where we'll be focusing about kidney transplantation services in Rwanda, which has started recently last year. Today we are joined by the Chief Medical Officer at King Faisal Hospital. It's called Dr. Sendegia Augustin. He's going to take us through how this program started, its impact so far, and the way forward. Welcome to our news segment.
Thank you.
Before we start by the progress and everything that has been done, can you tell us briefly the start? When did it start? Why did the program start initially? What was the need in the society?
Normally, when we talk about kidney transplant, there is a word kidney and transplant. So there should be a donor and a recipient, and the recipient normally has what we call chronic kidney disease, meaning that the kidneys are not working. And normally those patients, they need, when they have chronic kidney problems, they need to be helped by machines, what we call dialysis. So I think statistically there was an analysis which was done and which was showing that the patients with chronic kidney disease, the numbers were increasing because of different reasons. And most of the reasons are related to non-communicable diseases, mainly diabetes and hypertension. And with that analysis, normally the patients or people who needed to have kidney transplant were referred abroad on government fund, but others were going outside privately. So after that, and after the COVID-19 as well, COVID-19 has taught us a lot. It was showing that even when you have means, the movements can be very restricted and limited. So that's why after all those analyses, the government of Rwanda decided to initiate a program, a local program on kidney transplant. So it was a quite long journey because you need to be well prepared in all aspects to be able to start that program. So there was a legal component. I think there was a law which was passed concerning not only kidney but also replacement of all organs. Number two was to prepare ourselves in terms of infrastructure, in terms of equipment, in terms of consumables, in terms of medication, different medicines that are needed in the program, but most importantly to define who will do that, because we didn't have a local capacity to do that. So that's why we managed to create a partnership. We have partners that they help us to do or to perform those procedures, but also share the expertise. But most importantly, because of that, we made sure that in the course of all that process and the program, we build as well our local capacity. So after analyzing, after all that journey, there were so many preparations, we managed to start the program in May 2023. So it was a long journey, but we think that we are on the right track.
Moving ahead, can you provide an overview of the progress that has been made in this kidney transplantation services in Rwanda, considering that it is a recent service, it hasn't been a year?
So far, I think when you talk about the capacity, at least in terms of infrastructure, yes, the program is done only at King Faisal Hospital for now, but we hope that other hospitals as well in Rwanda will start performing kidney transplant, not only kidney transplant, but there are other transplant programs which will be coming. But we are happy to say that now, at least in terms of infrastructure and equipment, we have infrastructure and equipment. In terms of lab capacity, I think we have the capacity now, even if there are some lab tests that we are still sending outside to be, but we are building our core capacity. So we have been able to secure the supply chain of the consumables that we are using and the medication. And in terms of human capacity, we have, as I said before, we have our partners, but also we have initiated a fellowship program. So the people that are involved, Rwandans that are involved in the program, will be graduating maybe in 3 years because there is a kidney transplant surgery fellowship programs which have been launched and recently. So I think mainly we are on the right track. It's still a young program, but at least we have the foundation and the program will be growing. So I can tell you that when we started the program, up to now there is no patient that we send outside for transplantation, at least for kidney transplant. So it's a positive thing, but we'll continue to work hard because when you start a program, you have to be mindful of the sustainability of the program. It's not a cheap program. It requires a lot, but we think as the program grows, we'll be able to attract even international patients who will be coming here to seek for those services.
We cannot look only at the progress that has been made throughout these months, but what are some of the key challenges that you faced during the initiation of the program, and how have you addressed those challenges?
The question that we're asking ourselves, how, depending or according to the cost of the program, how are we going to sustain or financial support of the program? That's why with the collaboration with Ministry of Health, there were negotiations even before we start the program to agree on how the insurances could cover that program, because it's quite expensive to have to pay out of your pocket. So that's why there was, at the beginning, there were negotiations between ourselves, the Ministry of Health, and different insurances, mainly RSSB. It was a good thing that RSSB came on board, and especially the community health-based insurance, to be able to cover the cost of the kidney transplant program, because the costs is quite wise. So it includes the preparations, the clinic, the consultations, the tests that we have to do, both for the donor and the recipient, the procedure, the consumables that you use, but mainly even the medications that the recipient mainly have to take for a certain period, for a long period, just to limit the rejection, because your body can reject. It can, because it's even if you have the matching, your body can react saying, oh, you have introduced a foreign body in my body, and then the body will fight. So there are medications which are not, which are quite expensive, that you have continuously to take. So those are the challenges and the solutions that we had.
You previously mentioned that recently the Rwanda Social Security Board, as well as the Ministry of Health, introduced the inclusion of kidney transplantation services to the community-based health insurance. Can you briefly tell us how will this help residents and its impact to this to the society in general, because it is a life-saving procedure?
Yes. The program, up to now, we are using living donor. So it means on a voluntary basis, meaning that really it's a very big sacrifice to give an organ to a relative or a friend. So it's a sacrifice. You have to, the system has to make sure that you don't give a certain organ to, you have to limit the failure of the program. So the coming of RSSB on board to cover that, I think it is very important to the sustainability of the program and to the accessibility also for the, because the chronic kidney disease is not, it doesn't affect only people with means. It means that even the ordinary Rwandan can have that problem. So meaning that if the RSSB, Community Health-Based Insurance, agree to cover many the accessibility on the program of many people will be good. The program is expensive, but on the other side, when you see the cost of dialysis, the direct cost and the indirect cost, it means that on long run, it's very beneficial. Because to have a kidney transplant, the cost is high. I can say it's high at once. But when you see the long run, for a patient who can be on dialysis, secondly, patients who can't afford to be on dialysis, I think there is financial benefits. And we think that they will be doing a cost analysis in the middle of the program to make, to show the positive impact, especially in financial positive impact of the program when we'll have many or a certain number of patients.